My final guest is Congresswoman Robin Kelly of Illinois. She serves as the chair of the Congressional Black Caucus Health Braintrust and is the vice chair of the Energy and Commerce Committee. Congresswoman Kelly, it's great to see you. I just enjoyed having Donna Christensen on, and she held that job, way back. So let me just ask you, as you look at what we've been talking about, which is getting fairness, equity, and just getting more people covered with insurance that doesn't wreck them financially. What are the things on your radar screen that the government or other players out there in the private sector ought to do in terms of revising that social contract and bringing people more into healthcare that they can afford, sustainable healthcare, really?
Well, it was very good to see my predecessor. I was scared to death to take her place since she is an MD, but I'm still learning from Dr. Christensen. I really think that, we need to look at our healthcare system as a whole and a lot of the things that your panelists just said. Now, I couldn't remember if they said something about telehealth, because I think that telehealth could be the great equalizer if done correctly, especially as far as access. And I've spoken to constituents that I have, and they say how much it saved them time. They've been able to keep their appointments. They don't have to miss work. They don't have to miss school. And I've spoken to many doctors who have said that, and a lot of African-American doctors and doctors of color that said that their patients are able to keep their appointments much better, than in the past. But as was said, COVID has shown such a light on the disparities. The numbers that we see may be shocking, but they're not surprising because the disparities have been with us forever.
Well, let's go a little bit deeper on that. We have Leslie Krigstein, who's Vice President of Government Affairs from Teladoc Health, who sent in a question. He says, how can virtual care, meaning telehealth or remote patient monitoring, which I've discussed a lot with folks, particularly on diabetes, improve efforts to put the patients at the center of their care? You began to get into some of that, but I remember before the pandemic hit, we talked about telehealth. And, there was a lot of skepticism out there until, everybody came in. So as we discuss putting the patient first, is this a blind spot that's finally been removed, that now there's a new platform out there that actually begins to create new competencies and the ability to put the patient at the center of this process?
I don't know if there was a blind spot. There are places in my district. I have one of my hospitals, and I'm urban, suburban, and rural. So some of my rural hospital has been using it as one of my social service agencies when it came to mental and behavioral health. I am married to a doctor that had never experienced telehealth until COVID happened. He actually makes home visits. He goes into the home of senior citizens. And so he has used it now because he can't go into the homes, So, maybe after he gets his second shot, he can. But I do think, just from hearing his conversations with some of his patients, they do feel at the center of attention. And initially, the comments were, oh, you still care about me? Oh, you're calling me? Oh, I can still have contact with you. So I just think, especially with seniors, the idea of someone calling in or Zooming in or however the telehealth is done, it sends a powerful message. Some of them are by themselves, and my husband is the only one, that they may speak to in a week.
Congresswoman, there's another dimension to this. I love talking to you. I can tell you're having fun, and I love your tweets, by the way. So glad your mom got vaccinated and you were celebrating that. But part of the reason folks like you are showing that is that there's a distrust out there in some communities, that oftentimes we're talking about communities that have been marginalized. We talked with Donna Christensen, who said, there's a lot of systemic racism built into this. We don't have communities of color built into the doctors' healthcare systems to the degree that looks like America. And so part of the strategy has to be to talk about trust, right? Part of it is cost, but part of it is trust. And that's hard to legislate. But I'm interested in what you think we can do on the trust side of the equation, about vaccinations and about believing that the healthcare system that we have in place is not stacked against the patient.
Well, it's going to take a lot of work, and it's something the Congressional Black Caucus Health Braintrust, the Congressional Black Caucus Foundation, there's a Black Health Group against COVID. There are many of us working on this issue. In fact, I was on a national forum today. I'm going to do a local one tonight. The Congressional Black Caucus is going to join in with other partners to do something in March. We're going to keep talking about this to educate African Americans, but people of color in general about the vaccine hesitancy, that they have. Though I don't think you can legislate this in particular, because of course you can't make a person take the vaccine. But I think the more we can educate people, the more they meet people that have already taken a vaccine. Like I've had both of my shots and I'm okay. The more we can expose people to that, but also going forward, we have to diversify the healthcare field. We have to teach differently in the medical schools. I mean, we have to consider, I hate the word cultural competency, but I don't know how to describe it, but there's been many documented reports that people do better when it's someone that looks like them, or at least understands the reality of their situation. So, we're not going to just wipe away the trust completely. And I know people don't have trust even, in government also. That's part of the problem. They're concerned about, they think the vaccine, was created so quickly, just a lot of different things. But we answer as many questions as we can and try to get people comfortable. And again, try to identify ambassadors in the community that people feel trusted and comfortable around.
I couldn't agree with you more. And I just, I want to be snarky for a minute. I mean, this is something I discussed during the Trump administration with people like Dr. Anthony Fauci, Dr. Robert Redfield, Stephen Hahn at the FDA, and saying, is there a communications plan where you're able to go identify and even hire or, get pro bono participation from standout people from the different pockets of America and use them as ambassadors to talk to them, and said, oh, don't worry, we've got the communications plan taken care of. It'll be fine. It'll be fine. But, when I go to Minnesota and you talk to Native American communities there, you go and talk to Latino communities, you go down to Baltimore, where I've interviewed a young lady with all sorts of health issues in her family and talk about what it would take to get her neighborhood vaccinated. She said it would really be nice to have someone we trust or know or look up to talk to us. So I guess my question is, I agree with you 1,000%. Do you see the Biden administration making any bigger steps on finding those ambassadors than the Trump administration did?
I definitely do, because I am on energy and commerce. So I know there's resources put in the pot to grow the community healthcare workers. That those are people from the community that will deal with people in the community. There's money to build up the federally qualified healthcare centers. So I do think, there's a plan, and we voted on getting that plan, our part of the plan, out of Energy and Commerce last week, and it was submitted to budget this week. So I think that President Biden and Vice President Harris are very aware of some of the things that we must do to deal with disparities in healthcare.
Congresswoman Kelly, let me ask you a complex question. I had somebody last night who's a friend who's in this network of quality care and wanting to put patients first. He said, Steve, there's so many things going on in the sandbox of healthcare that no one's writing about. I don't want to mention the company that he mentioned, but he said there's an insurer that's becoming like the Apple computer of health, that is hiring more physicians than anyone else, that has its own PBM, and that these all change the winners and losers in the network, and no one's writing about it or where. It's a different type of topic than just looking at the question of how do you afford, expand affordable health care and deal with out-of-pocket costs. But it's the broad side of how do you keep all the players in a balance that's producing the best outcomes for the patient. I guess as a legislator, are you folks aware of some of the business changes that are going on and what their potential impacts on patient care might be?
I do think that there's just so much, as you've just
Right.
said. And I think that as a healthcare subcommittee and other committees too, like oversight, we try to stay abreast of everything. There are just so many issues. And you saying that will have me speak to Chairman Pallone or Chairwoman Maloney that we have to look out, for things like this. So we have to keep calling companies in or, witnesses in, whoever we need to call in to make sure that there is a balance and there is equitable treatment.
Well, Congresswoman Robin Kelly, chair of the Congressional Black Caucus Health Braintrust, of course, from Illinois. It's been a real pleasure to talk to you. Anytime I can help you, and anytime you have a good 800 words, you want to kind of share an idea with us, send it my way. And I'm happy to run it in the Hill. But thank you so much for sharing our views. And I think this is a real vital discussion. I know we're going to be at it some more, and I hope you'll come back.
Definitely.
That brings us to the end of our program today. A big thank you to Consumers for Quality Care for its support of these conversations, and to all of you attendees for joining us for this discussion. For those of you who missed any of the conversations, we're going to have the video up of the entire event on our website shortly. I'm Steve Clemons. Stay healthy. Be well.